Hello and welcome to the Health Classroom. Today we are talking about what to do when you find someone choking. Remember, choking is a medical emergency and some people always panic because they do not know what to do. But if you know the right steps to take, you can help save a life. Before we take a deep dive into this discussion, allow me to invite you to subscribe to this channel. You are there, you're watching, and you're yet to subscribe. Kindly help me by subscribing to the channel and liking this video and sharing it so that many other people can get to hear this and be able to learn about this and be able to save a life. So without wasting much time, let's get into it. Let's begin by understanding what is choking. Choking normally happens when food or objects block the airway and prevents the flow of air into the lungs. When air cannot flow into the lungs, the person cannot get enough oxygen. Even the brain's cells can start dying immediately. So remember, this is an emergency situation because this person is not breathing properly and therefore oxygen diminishes from the brain, and this can lead to brain death if medical attention is not given immediately. Common causes of choking includes eating quickly. You are eating very quickly, or you are laughing and talking while you are eating, or sometimes swallowing of objects. And this normally happens most frequently in children. They can swallow coins, they can swallow small metal objects that get stuck into the airway and prevent the flow of air into the lungs. Step number one, if you witness somebody choking, number one is to recognize and be able to recognize the signs of choking. And some of these signs of choking may include, you may find this person is clutching his throat, or this person at a time is unable to speak clearly, or is unable to speak, or unable even to cough, or unable to breathe. Those are the signs. And then sometimes you may see the lips turning bluish, indicating the lack of oxygen within the blood that's flowing on the lips. And also, this person might be in distress, very stressed, disturbed, and panicking. But if you happen to see a person who is choking, yes, but they can be able to communicate to you, which means they can be able to speak, you have to encourage them to continue speaking because, or continue coughing, because through coughing, that action might actually dislodge that object that is hindering air entry into the lungs or blocking the airways. Step number two, if you have, after recognizing the sign and determining that this person is experiencing choking, and then what you need to do now is to call for help, because remember, this person is not breathing properly and therefore he needs immediate medical attention. So you call for help, but as you are still calling for help, you can help perform some first aid by performing what we call the Heimlich maneuvers. I'm going to show you what that means. So the Heimlich maneuver basically means abdominal thrusts. And what that means is that if you find somebody choking, especially if it's a child 1 year and above and an adult, this procedure applies. So as you're waiting for emergency help to arrive, you go behind this person and place your hands under his belly. And then you make a fist of your first hand and grab with it with your second hand. You put under the belly, and then what you do, you thrust upward like this. Thrust, make an abdominal thrust like that. You do that repeatedly until this person can breathe and the object is dislodged. A common mistake that many people do when people are joking or they are choking is to hit their fist on the back. Don't hit these people on the back, because sometimes doing that can further lodge that object deeper into the airways. Now, if the person who is choking is a pregnant woman or is very fat or is very large, your arms cannot go through that abdomen, then you need now to thrust on there to make the chest thrust. You put like this, the fist, you put your hand here and then try to do the chest thrust repeatedly until this person can be able to breathe after that object has been dislodged. Now, for infants who are under 1 year, when you find them choking, especially after eating food or they have swallowed something, you need to take that child and place the child facing downward on your palm like this. This one will be holding your chest and supporting the neck and the head of the child. And then now using this place of yours, the heel of your arm, you gently give 5. single back slaps between the shoulder blades, like this: 1, 2, 3, 4, 5. As you try to dislodge that object, if it doesn't come out, then you done the child or the infant facing upward, still holding using this left hand, and then now you give 5 chest thrust in between the chest there, trying to dislodge that. So repeat the back slap and chest thrust severally until the object is dislodged and the infant is able to breathe once again. So in case you come about such situations, do not panic. Use these simple steps to save a life as you still wait for help to arrive. So somebody may ask you, how do we then prevent this choking from happening? It's very simple. Number one, avoid eating fast. Number two is that do not speak or do not laugh while you are eating. Have some table manners. And then sometimes you have to remove objects out of reach from children. These small objects that children can put in mouth, including coins, sharp things. Your children do not recognize all this. So make sure that the environment is clean, and make sure that you have these tips. You learn about these tips and first aid for choking people, so that whenever you find them, you can be able to save a life. If this video was helpful to you, kindly give us a subscription, like the video, share, and always remember to come back so that you learn more with us. Until next time, bye bye.